10 to 12,000 crores. In addition, we are now connecting 250,000 panchayats to optical fiber. This is going to cost us about 30,000 crores. And this network is already being built now. And we hope that in 18 months, the network would be fully operational. When this happens, you will have broadband connectivity at every panchayat with access to almost all villages. And this is going to be very critical in building national health information network. Along with this, we are creating platform for UID that Nandan Nilekani is working on. We have already, I am told, about 200 million registered, and we hope to get about 650 million people registered on UID or will be given UID by end of December 2013. And this is going to be a very powerful tool for health information management. Dr. Kasturi Rangan is helping us putting together National GIS. And National GIS is also going to be a very important tool in identifying all our resources, physical resources, like primary healthcare centers, diagnostic centers, hospitals, homes of doctors. During disasters, for example, we really need to know instantly all of the healthcare infrastructure. With this, lot of new applications being developed. We have roughly 10,000 software engineers in the government working on variety of applications with mission mode projects in mind. Passports, food distribution, NREGA are some of the examples. So when you put all of this infrastructure together, I think in next 18 months, we will have one of the most sophisticated infrastructure available to deliver good quality information and communication capabilities for health industry. When President Obama was visiting India, I had an opportunity to talk to him about our effort to connect panchayats. We even gave him a demonstration. And as a result of that, we started a joint program with the US government on open government platforms to share data with public. US already had data.gov. With the Indian software team working together with the US government software team, we have now developed an open government platform that we are going to be offering to various countries in Africa and other places. And there is no reason why India cannot be the champion of the health IT, not only for Indian solutions, but also for the global markets. At the National Knowledge Commission, we had recommended several key initiatives for the health IT. Unfortunately, very little of this has taken roots in the ministry. It took almost 4 years for the health ministry to agree on developing health portal. I don't know what is the status of it now. Initially, a great deal of energy was put in. Lots of people worked on it. I remember Sangeeta Reddy worked with us, and she participated actively in many meetings. Similarly, a lot of the other leaders in the industry, health industry, were quite excited about the set of recommendations National Knowledge Commission focused on. But as usual, we have not been able to execute, implement, and focus on delivering on a lot of these ideas. There, the recommendation related to creating healthcare network, focusing on standards for the country, working on electronic health record, creating right policy framework to promote ICT in health, create health data centers, worry about privacy, piracy, security and all that, and make health IT a part of health education, medical colleges, create institutional framework required to implement IT. For example, if you don't have chief information officer in a larger institution or government system, it is difficult to implement health IT. In particular, we focused on 4 key areas: health portal, electronic health record, health information network is a virtual network riding on the national knowledge network, and applications for mobile phones for health. A large working team from all over the world was put together, a virtual team. Team spent almost over a year with experts from US, Canada, Europe, and naturally all kinds of experts from India. A lot of this work is sitting in the background, and I'm afraid to say that very little has been taken up for active implementation. I have been working with the ministry, with the planning commission. Everyone has been giving a great deal of lip service, but when it comes to implementation, we have really not done a good job. People talk about telemedicine a great deal. There are some good examples of telemedicine. There are equally good examples in the country of health management system. The real challenge is scaling it. How do we scale a lot of this stuff? It's not that we don't have the expertise. It's not that we don't have the software. I think the real challenge is providing the right kind of leadership to scale it. And we are not going to be able to scale a lot of these solutions if we just follow blindly Western model. Because I believe Western model are not going to be cost effective. We really need affordable, scalable, and sustainable models. And that's where I think the emphasis on mobile connectivity, emphasis on broadband availability, and focus on Indian talent to come up with Indian solutions, Indian models of development is going to be very critical. I think we are at a tipping point in the health IT. We have the expertise, we have the need, and if we put all our energies together, we can probably drive next generation health IT solutions for the world. We really need simple electronic health records. We don't need very complicated records that US and other countries are using. We don't need many protocols to start with to complicate applications. We need simple solutions with personal health record as a starting point. We need low-cost diagnostics equipment which can be operated by sort of people in the villages who are not highly sophisticated and knowledgeable with electronic equipment. We have Anganwadi workers We need to take advantage of that infrastructure. We have large number of government centers, primary healthcare centers, which could be upgraded to handle local need for the health IT, and we will have the connectivity that you need. So you need low-cost diagnostics equipment to quickly put information per patient on the cell phone, connect those to telemedicine centers, because a lot of our doctors, rightfully so, don't want to go into villages because there is very poor other infrastructure. So we need to bring expertise to the village through health IT. Then through connectivity, provide access to the best of the best qualified health experts to everybody in India. I firmly believe that with focus on low-cost diagnostics, mobile health, we can create new beginning. But it will require innovations, new mindset. We cannot solve the problems of the 21st century with the mindset and processes of the 20th century. I've been saying time and time again that I find at times we have 19th century mindset, 20th century processes, and 21st century needs. How are we really set out to bring healthcare ecosystem, all kinds of players, to global platform to participate, propagate, and promote various health technologies to really